Drugs affecting uterine motility. We are discussing the drugs which causes uterine relaxation, uterine smooth muscle relaxation. And let us see the next drug, indomethacin. Indomethacin, it is the main category is non-steroidal anti-inflammatory drugs, NSAIDs. How it act? Prostaglandin synthetase inhibitor. It inhibits the prostaglandin synthetase enzyme, which is responsible for the synthesis of prostaglandin. And we know that the prostaglandins are responsible for the contractions of the uterine smooth muscle. So if there is no prostaglandins, no contractions. So it is useful in the prevention of the preterm labor in less than 30 weeks of the pregnancy, preterm birth less than 30 weeks of the pregnancy, and it is off label. Off label means it is not approved by the FDA. Use this drug for the prevention of the preterm labor, but it is found useful for the prevention of preterm labor. Side effects, renal impairments. As we know that most of the, not most of the, all of the NSAIDs except paracetamol is having not effect on kidney functions. So obviously renal impairment is one of the most adverse effect, common adverse effect, elevated liver function test, and which may leads to the jaundice by the increase in the bilirubin level. These are the adverse effect for indomethacin. So, as we discussed, prostaglandin analog causes, that is dinoprostone causes myometrial contraction, and prostaglandin synthetase inhibitor indomethacin causes myometrial uterine relaxation, vice versa. Magnesium sulfate, it is used as a tocolytic to stop the preterm labor. Tocolytic, uterine relaxation, the drug which causes the uterine relaxation. Off label, indicated to prevent the seizures associated with preeclampsia and for control the seizure with eclampsia. Yes, this is a most important complications during the pregnancy. If the blood pressure is higher and there is a protein in the urine after 20 weeks of the pregnancy, there is a chances of the seizure in the women, and this condition is termed as eclampsia. So magnesium sulfate, it is used off label to control the preterm labor. How it acts? It promotes the movement of calcium, potassium, and sodium in and out of the cell and stabilize the excitable membrane. It stabilizes the excitable uterus membrane, leads to relaxation. Adverse effect includes hypotension, hypophosphatemia, there may be the low level of the phosphate, hypocalcemia, low level of calcium in the blood, and hyperkalemia, increase in the potassium level in the bloods. These are the common adverse effect associated with magnesium sulfate. Magnesium sulfate, if you Remember, it is also used for the management of the torset D point in arrhythmia, QT prolongation. Yes. So, what is the role of magnesium sulfate? It is used to stop the preterm labor because it causes the calcium out of the cell. Out of the cell, no calcium, relaxation. And also indicated to prevent the seizures associated with eclampsia. So remember, ergometrin is used before oxytocin infusion for induction of labor. Why? It's very important. Now, ergometrin or ergonovin, the another name is ergonovin, is used before oxytocin infusion for induction of labor because this ergometrin act via adrenergic receptor, alpha adrenergic receptor, which will causes the vasoconstrictions. So it will also use to prevent the postpartum hemorrhage. So for the induction of labor, the full term pregnancy, give the ergometrin and then oxytocin. Oxytocin increases calcium ion per intracellularly. That's why it causes the contraction of the uterus. Mifepristone is progesterone antagonist, not used for induction of labor. Remember, these points is for your MCQ. Mifepristone is progesterone antagonist and not used for induction of labor because mifepristone typically used to bring out an abortion. So don't mix dinoprostone with mifepristone. Dinoprostone is a prostaglandin analog which causes contraction of uterus. So mifepristone typically used to bring about an abortion. And mifepristone is progesterone antagonist and dinoprostone is prostaglandins analog. So please remember the progesterone is different one and the prostaglandins is a different one. And obviously atosiban is oxytocin antagonist. Thank you very much.